What brought me into Lone Star Orthopedics was I've known Dr. Werner and worked with him for about 9 years. He and I kind of had a friend relationship, and he just noticed one day that I happened to be limping down the hall, and he said, "What in the world is wrong with you?"
She was having a lot of pain in her big toe joint, especially with wearing high heels and running.
The pain that I felt was almost to the point of unbearable by 5 o'clock. I had a toe joint replaced in my big toe.
She had difficulty bending her great toe, and on exam we could feel there's a palpable nodule by the big toe joint area, and we had x-rays done, and she was getting the beginning stages of arthritis in the big toe.
I would have pain in my foot every night when I got home from work, and it got to the point where after working I would be limping, and one day he saw me and said, "Gosh, we need to take an x-ray and find out."
I diagnosed it as hallux rigidus, and where she has a rigid toe, and that basically is just a medical term that we use to describe a rigid toe. And you can have it for a variety of reasons, from a bunion deformity, from having arthritis. It can be even the soft tissue impingement.
We took an x-ray, and I had a very arthritic joint in the big toe, as well as some bone spurs that were causing the pain.
On her x-ray, I mean, I don't have them here with you, but the joint right here where we have most of our motion when we push off and when we're running, this is where she had most of her pain and her issue. And she had a lot of bony growth across the top here.
So Dr. Werner recommended having the toe joint actually replaced.
Here's a model of what it looks like that we put, that ended up being done in Janice, and this was what she opted for. This is something that was the other option for her that would allow her to retain the motion of her joint, but at the same time get rid of all the extra bony growth and give her a smooth motion.
It took about 3 months before I was hobbling around without the boot.
It can stay sore for about 2 or 3 weeks even after that, as she's working it out, having a new motion.
And then about 6 months I started to get really active again. Within a year I was running, and I do run now about 2 miles four nights a week.
She ended up able to run pretty soon after that, further than she ever has, and that was a really great feeling for myself to see her being able to do that, and because it was a big change in her life. She was really happy, able to be with her kids again and be out in the yard doing those things with her kids and her husband.
And I get to wear my high heels, so that makes me super happy.